Hi, I'm Dr. Lin, founder of IQ Laser Vision. LASIK has been well known to people in the US for the last 25 years. And the reason is it's an excellent procedure with a very long positive track record. However, when your prescription is higher than -7, or your health of your cornea is not as good, then we may have to think about other technologies that may be better for you. At IQ Laser Vision, we're dedicated to providing the best FDA-proven technologies to make sure that you get the best outcome with the greatest amount of safety. Now, as our prescription increases over -7, what happens is the cornea is flattened further, and there may be induction of something called higher order aberrations, which can reduce the quality of vision. Furthermore, we're reducing the amount of corneal tissue you have, and that can weaken the cornea in a condition called keratoconus. Now, keratoconus is naturally occurring in about 1 in 2,000 patients. If your corneal map looks abnormal, or your cornea is thinner, or even you're younger, or you have a history of rubbing your eyes like this really hard, please don't do that, because that actually will increase your chance of keratoconus. What we want to do with our advanced technology is to make sure you don't have these conditions. And if you are suspicious for having this condition, we will recommend a different procedure, such as the EVO ICL. Now, the EVO ICL, what's amazing about this technology is it's an additive technology, which means we're not removing the tissue, your cornea, we're not flattening it, and the cornea stays just as strong as it was before this procedure. The EVO ICL is an excellent technology that's actually very well known throughout the world. In Japan, it's actually the #1 procedure that's performed, surpassing LASIK. Now, this is an additive technology where we're not removing any tissue at all. We're not flattening the cornea. And this is what gives us higher quality of vision with less induction of something called higher order aberrations. Also, this material that's been used in the eye has been used for over 30 years. It's made out of polymer, which is a variation of collagen, which is naturally occurring in the eye. Finally, this is a permanent procedure, but even though it's permanent, it's actually removable if there's problems. It's a very rare case where we'd have to do that. Some of the risks of ICL from the past are actually pretty much non-existent these days. One of these is a cataract forming earlier than normal. In the new study with EVO, which has a little center hole called the central port, this allows more nutrition for the natural lens. The rate of cataracts is actually almost 0. So that's great news for us. The second, the chance of a pressure increase in the eye or glaucoma is virtually 0 when the lens is sized properly. Now, we have special instrumentation called the arc scan, which allows us to size the lens optimally. In fact, if we don't use the technology and we rely on the FDA-approved method of sizing the lens, 52% of the time we actually put a suboptimal lens. For most people, it's actually not a problem. We're not going to have these pressure problems, and we're not going to have a cataract because the lens now is so forgiving because of the advanced technology with the central port. However, it's always best to have the optimal lens, and so that we can further reduce any potential of these side effects. We'll talk a little bit more about the arc scan technology, which is an amazing addition to our portfolio of technologies to make the best outcome for you and your family. If you want to live a life without glasses and contacts like I have 25 years ago, don't hesitate. If you're not a great candidate for the LASIK or SMILE procedure, the EVO ICL is an excellent option for you to realize your dreams.
EVO Vision ICL is an implantable Collamer lens that can correct common visual limitations like nearsightedness and astigmatism, freeing you from glasses and contacts while harmonizing with your natural eye. EVO Vision ICL's Collamer material contains a small amount of purified collagen, and the remainder is made of a similar material to that found in soft contact lenses. Collamer makes the EVO Vision ICL lens soft, flexible, and biocompatible, which means the lens is stable inside the eye. Let's see how this quick and simple procedure works. Before your procedure, your doctor will perform a series of standard tests to measure your eye's unique characteristics. When you arrive for your procedure, your doctor will administer eye drops to dilate your pupil as well as anesthetize your eye. The procedure follows 3 steps. Step 1. Your doctor will create a small opening at the edge of your cornea to insert the EVO ICL lens. Step 2. The EVO ICL lens is folded and inserted through this small opening. Step 3. Once the EVO ICL lens is inserted, the doctor will make any necessary adjustments to ensure its proper positioning in the eye, securely placing it behind the iris, the colored part of the eye, and in front of the natural crystalline lens. The EVO ICL lens is not visible to you or others. The EVO Visian ICL works in harmony with your natural eyes to provide exceptional quality of vision. Take the next step towards visual freedom. Find out more about EVO Visian ICL from your doctor.